So I got my vaccine at the hospital. So it was put into Epic. It went to the state vaccination registry. So all these apps, and we're fragmented now, right? There's no one app that you could go to that says, I am the passport app. The federal government has said it's not going to do that. It's not getting into that business. There's no federal COVID vaccine registry out there. So how is HIMSS by August going to have a vendor that can connect to all the state registries, bring that data together, no duplication, and have accurate information to tell my COVID status when I walk in the door? I don't know.
So let me tell you how I think they're going to do this. And I could be proved wrong. The vaccine credential initiative's out there. There's 300 participating organizations. But again, and that's ready to be deployed, but it's a framework that others consume, right? So you have these passports that can bring the information in. I went to Costco the other day and I'm walking in and I'm searching for my card. I realize I don't have my mask on and I show him the card. I said, hey, what's your mask policy? He said, well, if you've been fully vaccinated, you don't have to wear your mask. But if you have not been fully vaccinated, we would like you to wear your mask. I said, okay. I said, well, I've been fully vaccinated. I'm like, would you like to see the card? He goes, oh no, we're not checking. I'm like, okay, because I have my card with me, just because I had it with me for whatever reason. Plus I have it on my phone. I took a picture of it, right? And put it on my phone because I was done at the health department and I got the old vaccine card, hand signed little thing. And I thought, and I even said to the guy as he was writing it, I'm like, how hard would that be to forge? He goes, not hard at all. I said, how's that? And I also asked him, I said, how's that going to get into my medical record? He goes, it's probably not going to get into your medical record. I'm like, yeah, that makes sense to me. I don't know how you would have access to my medical record to get it in there because it wasn't done by a health system. It was done by the health department, and everything was really paper-based. And so here's what I think is going to happen at the conference. Okay, you have to provide proof of vaccination, which a lot of people are going to have the card, and you can provide that card. And they're going to say, okay, you've provided proof of vaccination. And it becomes an honor system, really.
Yeah.
Because if I want to forge the card as an unvaccinated person and go to the conference, I guess I could. I'm not sure why I would do that, but I guess I could do that. From their standpoint, hey, we checked everybody to the best of our ability, given the technology that's currently available. We didn't like scour the registries or anything, but we checked everybody. And at the end of the day, to be honest with you, and again, you're a physician, I'm not a physician, but this is just I'm just reading the data and I'm reading this straight from the CDC websites and others. The chance of someone with the 2 shots of the Moderna or Pfizer vaccine actually getting COVID is 0.007. All right. So if my chance of getting COVID is 0.007, that is well within my parameters for leaving the house and interacting with people. Because I do that every day when I get in my car and I do other things. So I recognize that there's a chance I could get COVID. But the other thing I would say is there's no surge going on in the hospital. So I'm not really concerned if I have to be taken to a hospital. The third thing is that the vaccine is actually proven to reduce the impact of the virus on me. So that's the third thing. The fourth thing, quite frankly, is we know more today. We're over a year into this. We know which treatments are working, which treatments aren't working, and we're just better at this. Now, I don't want to get COVID, and I don't want to unduly increase the risk of getting COVID for any reason, but I'm also not worried if a handful of people happen to be there that have COVID, because first of all, it's in Vegas. You're going to run into people who have COVID or are unvaccinated. You're going to sit at the blackjack table. You're going to interact with the hotel staff. You're going to Uber. You're going to get on a plane. So there's no way to really create a true bubble around this. So that's just my thinking. So how crazy am I with the stuff I just said?
I think you're spot on. I think the question is more about, will you get the experience that you're used to getting at HIMSS, where I've gone to go get into a presentation and you can't get in the door. Well, now they're going to block off seating, it sounds like. On their webpage, they're talking about how they are going to separate. The presenter's going to have a shield, a face shield on. Is the experience going to be the one that you want? The downstairs floor, the vending, they're going to space them out differently. Maybe they have less vendors coming. And so that's my question for HIMSS is, can you pull off the production? Can you, the show that is HIMSS, that circus atmosphere is HIMSS. And maybe it's good, maybe change is good. But I think people have certain expectations around HIMSS, and I wonder if this year's going to meet it.